Good morning, everybody, and welcome to Medtech Unfiltered. I'm Amanda Pedersen. I'm the news editor at MD+DI, and today I want to talk to you about the uBiome story that MD+DI published earlier this week. In fact, it was a story that was covered widely in mass media, and that is primarily because it made for a good poop joke. And don't get me wrong, if the people that know me the best know that I love a good poop joke. In fact, I kind of live for them. But in this case, I think that it needs to be pointed out that this story has implications for the industry that go far beyond just making a good poop joke in a headline. And I saw some good ones. In fact, I think my favorite one was, turns out that that stool testing company was full of it. Not gonna lie, I kind of wish I thought of that myself. But as I said, this story, for those of you who are not familiar with it, it's a story that really sounds familiar to the industry. In fact, it's hard not to think of Theranos when you hear this story. So uBiome was a San Francisco-based company, and recently, earlier this week, late last week actually, the co-founders, the two co-founders who are actually now married as it happens, they were indicted on formal charges from the Securities Exchange Commission, claiming that they misled health insurance providers, their investors, and doctors and patients. So it's pretty serious allegations. Apparently, it started back in 2018 when they were raising money for their C round, and their C round financing. They raised $60 million, valuing the company at the time at $600 million. So that's not chump change. And it was all based on misleading investors into believing that their technology was much better than it actually was. They were a stool testing company, and they allegedly violated all kinds of ethical and scientific rules, so to speak. Including using old stool samples that customers had provided to do testing. And they were warned by their employees, including the director of their laboratory, that this was not that this could be a problem. This could get them into legal problems, as it in fact has. So they were, according to the SEC complaint that was filed, they were aware of the fact that their technology was not what it was cracked up to be. And just like in the case of Theranos, they continued to go by the philosophy, fake it till you make it. And that's just not acceptable anymore, if it ever was, which in this industry, when you're dealing with people's lives and health, not. And if it sounds like I'm taking personal offense to this particular case, it's because I am. About 22 years ago, I was diagnosed with an inflammatory bowel disease, and that is one of the conditions that they were testing patients for. So doctors would convince doctors to do these tests on patients' stool samples to determine if they had IBD and what kind of IBD they had. And they also later expanded into women's health and sexually transmitted diseases. Anyway, my point is that we all got a good laugh at the headlines, and we kind of made some jokes of our own in the story that we published. And but it's not a joke at all. And in fact, industry really needs to stand up companies that are doing this, particularly in the diagnostics community. Given the situation that we've been in for the past year with COVID-19, more important than ever. That's not to say that it wasn't important before. It's always been very important. But it's the public eye is on the diagnostic space more than they ever have before. So when a test is inaccurate, and sometimes those are just honest mistakes or honest failures, or the technology just needs more work and development. But when it comes down to the co-founders of a company just blatantly lying, again, allegedly, they have not been convicted or found guilty. These are allegations brought by the SEC. When we hear about these stories, it just makes it that much harder when it's already so incredibly hard for a med tech company or a diagnostic company to raise money and to of their technology. They have so many barriers to adoption. They have to, they need the funds to fund it. They need to go through the regulatory hurdles and convince FDA that it is both safe and effective. And they have to convince health insurers, health insurance companies, that it should be reimbursed, that it's a technology that is worthy of reimbursement. And then they have to convince doctors to prescribe these tests and patients in turn to use them and trust them. And, you want to talk about trust issues. Hearing stories like this is why so many patients have trust issues. They don't know if they should trust their doctor because maybe their doctor is getting kickbacks to prescribe such tests, or maybe their doctor is just regurgitating everything that the salesperson told them and hasn't actually looked into it. And there's just so many levels where trust becomes a problem when you're dealing with people's health. And so these are really serious allegations that I've always said that the best thing about everything that happened with Theranos is that it served as a warning and a cautionary tale for the rest of the industry. The rest of the industry can take note of what Theranos did and didn't do, and the mistakes that they allegedly made, and take precautions themselves and put policies and procedures in place at their own companies to ensure that this never happens to them. Nobody wants to end up being the next Theranos, or in this case, the next uBiome. uBiome was not as well known, of course, as Theranos, but they did have quite a bit of support, and there was quite a bit of enthusiasm around their technology. So I apologize if I'm on my soapbox. I am, in fact, on a soapbox, but it's because I really care about this industry, and I really care about patients, and I just don't want to see this happen again. I don't want to see good companies have to climb that much higher and work that much harder to overcome these barriers to adoption because of the failures and mistakes and flat out lies told by other companies in the space. It just really gives the industry as a whole a bad reputation. Theranos did no favors whatsoever for the industry in terms of reputation, and if the allegations against uBiome prove to be true and they're found guilty of these charges, then that's just going to be another hit to the industry. And we all remember the Bleeding Edge documentary that was that Netflix aired a few years ago, and that was kind of a wake-up call for the industry as well. That patients are paying attention and patients are well educated, and they're not just blindly following their doctor's advice as they might have done in the past. They have access to information and they are seeking out that, they are educating themselves and becoming increasingly taking charge of their own care. So it's just, it's a hot button topic for me for a lot of reasons. And it would be even if the disease that they were trying to test for wasn't something that impacted me personally. But in this case, it actually does. So I'm just going to be on my soapbox about it all I want, and I apologize for that. So back in 2016, when the Theranos story was big in the news, MD+DI published a story where we had spoken to a regulatory consultant by the name of David MR, and he provided several really good tips for the industry on how to avoid finding yourself in a situation like Theranos did. And I'll go ahead and provide the link to the story as soon as the video is over, and you can read those yourself. They're very good tips. I really encourage industry making a diagnostic test or a medical device, or even a pharmaceutical for that matter, to really take heed of these tips and take this seriously if you're not already. A couple things that he mentioned, I'll just name a couple. Be strict about documentation and control, but be stricter about intended use. And I can't help but just add a couple of my own advice. I'm not a scientist, I'm not a doctor, I'm not an engineer. I Medtech, and I have done so for, well, I don't want to date myself, but a really, really long time now. And I'm very passionate about this industry. I think you can probably tell from my videos that I really, truly love medtech. I love covering the medtech space. I love talking to people in the industry. I'm constantly learning. I don't, I am, I guess you would call me an but that's not to say that I know everything that there is to know about medtech. I learn every single day. I'm very passionate about this industry. But it's really just basic things. You don't have to be a scientist or an engineer to know that you really shouldn't lie to your investors or your stakeholders, any of your stakeholders. Listen to the experts that you do hire. If your scientists and engineers come to you and say, look, the way that we're doing things isn't right, and this could raise some red flags, and this could get, FBI could be, this could be, a problem. FBI could be rating us for this or whatnot. That uBiome a few years ago, which is what led to all of this unfolding and ultimately led to these formal allegations being filed by SEC. So really, it comes down to honesty and not being greedy. I mean, both of these co-founders, it's not the company, the company itself made millions of dollars off of these false allegations, misrepresentations of their technology, but they themselves each made millions of dollars off of that Series C round in 2018 as well. And then, they ended up having a romantic relationship and getting married. In my head, I'm like picturing how this happens, and I'm like, yeah, I can totally see it. I can totally see how that would happen. And in fact, that's just one more thing they have in common with Theranos. But besides the point, I just think it's a really important topic, and I really encourage you, if you have not already read the story. I know a lot of the mass media covered the story. They kind of covered the highlights and the broad brush scopes. But the fact of the matter is this has serious implications for the industry. So I really encourage you to read the story that MD+DI published. I'm not saying that just because our publication published it or that I wrote it. I just really think that these are really important things to take note of. So we will, of course, be following the story and bringing you updates as they happen. And another thing that David Amor talked about was ability studies, and that's something that is very important, even probably more so than ever before in today's environment. And we're going to be talking more about that next week. So I really hope you can join us. Once again, I'm Amanda Pedersen, news editor at MD+DI, and this has been MedTech Unfiltered.